Welcome everyone to today's session. My name is Felicity Taylor-Drewe and I'm the Chief Operating Officer at GWH NHS Foundation Trust. I'd like to just introduce my colleague John.
Hi, my name is John Westbrook and I'm the Medical Director at Great Western Hospitals.
Today we're also joined by Steve Maddern, Director of Public Health at Swindon Borough Council, and it's a joint question and answer session to answer some of your most frequently asked questions about COVID-19 and the recent surge in case rates. We know many of you are curious and also concerned about the impact that this is having not only on our hospital but also on day-to-day life in our local communities and what this might mean for you when you're trying to access healthcare. Before we go into detail and answer your questions, I'd like to hand over to Steve, who's just going to give us an update in terms of the wider picture currently in Swindon.
Thanks, Felicity. So thank you for the introduction. As mentioned, my name is Steve Maddern. I'm the Director of Public Health at Swindon Borough Council. I will also play host for this session. So not only will I be answering my own questions, but I'll also be directing questions to Felicity and John, and hopefully this session will give you some insight into COVID across Swindon and answer some of your high priority questions. So to give you an update in regard to COVID in Swindon at this moment in time, we know that across the past month we have seen exceptionally high rates of COVID cases, although we have seen that begin to decrease across the last 7 to 10 days. The case rate in Swindon currently remains quite high. So as of the 5th of November, which is our most recent data, the case rate was 625 per 100,000. What that means in real numbers is that's around 1,400 new cases we've seen across the last 7 days. And this puts us in a case rate level that was very similar to what we were seeing in January. So there's a lot of community transmission that we're seeing at this moment in time. So it's even more important as we head into winter that we are more vigilant and that we do what we need to do to protect ourselves and each other as we head towards Christmas and the new year. We know there's lots of things we can be doing, and we'll talk about that throughout the session this afternoon as well. And it does include the familiar messaging of hands, face, space and ventilate, but also we'll talk around COVID vaccination and regular testing as well. So without any further ado, I think let's get into the questions. So Felicity, the first question is for you. What is the level of impact that COVID has had on the hospital, and how much extra capacity does the hospital have for more COVID patients if needed?
Thanks, Steve. Yeah, we've been at a relatively sort of static position of around 40 to 50 COVID inpatients for a number of weeks. But we did see that number rise to more than 70 for the first time last week. Just to put that in context, that's actually where we were. We've actually exceeded where we were in terms of the lockdown back in November 2020. So the numbers today, they've dropped to around 47 inpatients, but it's the knock-on effect from last week and our high number of urgent and emergency admissions that we've had to deal with has put significant pressure onto our beds. And that's for both COVID and non-COVID patients. We are well prepared in terms of our escalation plans. We've practiced this now in terms of dealing with a further surge. And things that we do are like identifying staff who we can redeploy to support our COVID areas, and we flex our bed base for our COVID and non-COVID patients. I would just at this point, Steve, like to say thanks to all our staff in terms of how they've responded during this recent couple of weeks in this period of time that we've gone through. Thanks, Steve.
Fantastic, thanks Felicity, and I think a general wider shout out to anybody working across Swindon at this moment in time that is supporting people to live the healthiest lives they can, but also protect them from COVID. But yes, particularly recognising the strain on our health and social care staff at this time. So the next question is for me, and I must just add that if you are putting comments into the comments box, if we don't address your questions today, then we will address them at a future session. So do keep those comments coming. So the next question for me is, as there aren't any COVID or many COVID restrictions in place at the moment, what can we do to keep ourselves safe and our families safe? So I suppose that does reflect that actually we have very few legal requirements at the moment around COVID-19. The main one we have is very much that if you have COVID symptoms, you do need to test and you do need to isolate if you have a positive case result, and there is a legal requirement to isolate for 10 days if you do. As I've already mentioned, it is very much around hands, face space, keeping your hands clean, keep your distance, particularly from people that you don't know, and do wear masks or face coverings in crowded areas, particularly on public transport. The other key message is very much around promoting vaccination. So if you are eligible, make sure you get your vaccine. And if you're eligible for booster doses of your vaccine, then make sure you sign up for that as well. The other key message is very much around regular testing, and so you should be looking at using lateral flow tests a minimum of twice a week, or before you're going to events where you are likely to be mixing with people that you don't usually mix with. So these are the core things you can be doing to protect yourself from COVID in general, but particularly as we head into the winter. Okay, the next question is for John. So, John, can local people still walk into the hospital to have their COVID vaccine?
Yeah, Steve, thank you. First off, of course, I'd like to encourage everybody to have the vaccine and the booster when appropriate. There's no doubt that it does reduce your chance of contracting COVID, and if you still contract COVID, it then reduces the chance of you having severe illness and needing to be admitted to hospital or even intensive care. So our vaccination hub is no longer open to members of the public, as we're now focused on the booster programme for our staff. However, offering the COVID vaccine to inpatients who are at risk of getting seriously ill from COVID. There are lots of ways that people can still get their jab, however. So you can book an appointment online with the NHS website, or just call 119 to get your jab at your closest vaccination centre or pharmacy. You can, of course, use a walk-in centre, and there's a finder for these on the NHS website where you can get vaccinated without the need for an appointment. I would encourage you to always keep a lookout for social media messages, which will post frequent information on where your nearest walk-in centre will be. Alternatively, you can wait to be contacted by your GP surgery and book an appointment through them.
Fantastic. Thanks, John. And the next question is also about vaccination, which is for me. So the question is, if the majority of people are double jabbed, then why do I need to wear a mask or open windows? So as you've already highlighted, John, it's really important that we get vaccinated, but vaccination doesn't necessarily mean that you can't catch or pass on COVID. The vaccine is very much designed to reduce the severity and prevent premature death. It is important that if you've been vaccinated, that you do continue to use the other tools at your disposal, including the hand washing and the distance and all those things, but particularly wearing that face mask, because your face mask helps you to protect others, and by others wearing theirs helps them to protect you. We know when it comes to things like ventilation, outside is always best, but we are heading into those colder winter months, but it's still really important that you regularly open those doors and windows. We know that ventilation alone can help to reduce COVID transmission by around about 70%. So that's why it's another important tool that we can use to protect ourselves and each other. Felicity, coming back to you. So, will the rise in cases mean that the hospital will need to cancel appointments, surgery, or other non-COVID treatments?
Thanks, Steve. Absolutely being clear at this point, we aren't cancelling any appointments or operations or other elective procedures that are as a result of COVID-19. Clearly that position can change. If it does, we will do our best to update people as soon as possible and let patients know if there are any changes to their appointments. We want to really express, how much we're here for our local communities. We don't want to stop any activity. So we're working through our waiting lists as quickly as we can, and our staff are doing everything they can to see patients as quickly as possible. It's really important that you attend your appointment as normal, and we just want to make sure if you can't come, please let us know so we can give that appointment to somebody else who really needs it. So please attend your appointment, as it's important to make sure we don't put your health at risk otherwise. Thanks, Steve.
Thanks, Felicity. So the next one is for me. So could there be another lockdown in England? And if not, what measures could the government introduce in case we see those cases increase? And could this have an impact on Christmas? And it's timely, isn't it? Because we're only about 50 days away. Love it or hate it, it's on the horizon. So we know that the government has consistently said that there is no plans for another lockdown in England in the way that we have seen them across the pandemic. However, the government could potentially bring in extra measures in England, which effectively is part plan B of the autumn and winter plan. So this plan B is very much designed to protect the NHS if it is facing unsustainable pressure. So this is something that we collectively monitor along with the national government as well. So measures under Plan B could include the reintroduction of mandatory face masks and also encouraging people to work from home where possible. And it could also see the introduction of the COVID-19 pass. Could this impact on Christmas? Well, absolutely, this could have an impact on Christmas, but as we are seeing Christmas on the horizon, the way that we will face Christmas this year is very much in our hands. So it's really a call to arms now that what Christmas and winter will look like is very much in how we respond to COVID now. So again, I know I'm going to keep saying it as we go through this messaging, but it is very much around hands, face, space. But also, if you are eligible for your vaccine, please make sure you have your vaccine, particularly your booster. And again, all these little things can very much help to assist us in trying to have as normal Christmas as possible. Okay, the next one, coming back to you, Felicity, then. So you've been saying that the hospital is extremely busy, and it has been for a very long time, but when will things get back to normal?
Thanks, Steve. Yeah, it's a great question. I think we have to realise that this is the new normal post-pandemic. I don't think things will be the same again. We're working really hard. Our staff are working really hard to reduce the number of patients that are having to wait a lot longer than we would ever have wanted to be the case. We've made some good progress. So I'm just going to give an example. So patients who've been waiting over a year or more for some treatment. Back in February, this was a number that was at just under 2,000, so 1,996. I'm pleased to say that this number, as we stand here today, is down to 680. But we're looking at that number still to be, unfortunately, around 450 at the end of March. So many more patients than we would want to be waiting longer than a year at this point in time. Absolutely. We're looking at new ways of working, so virtual, absolutely a key tenet of what we're trying to take forward. And we've really asked our patients that if that's something that you'd like to do, we'll encourage you to take that offer up. It's really important for us to be able to give advice in a forum such as this. You know, for follow-up care, it works really well. We'd also ask that people look to choose the right healthcare options for them. Often you don't need to come into the hospital at all, pharmacy 111, and I'm sure there'll be another question later that would be in that regard. So yeah, thanks, Steve.
Fantastic, thanks, Felicity. So perfect next question for the medical director. So John, can you just give our listeners or our viewers some insight in how do we actually treat a patient that has COVID in the hospital, and do we treat them in the same areas as other patients that don't have COVID?
Yeah, thank you, Steve. Yeah, so every patient admitted to hospital now is tested for COVID on the day of their admission, and then we test them again on the 3rd day, the 6th day, and every 6 days thereafter. And of course, if they develop symptoms of COVID, we test them straight away. So if a patient shows symptoms of COVID, they'll first be assessed in our COVID assessment unit, and then they'll be admitted to the appropriate ward, depending on the outcome of that assessment. We've got a number of COVID designated wards in the hospital to ensure, so far as is possible, the COVID and non-COVID patients are cared for in separate wards. And when things get really busy and we have to split wards, then we keep those areas safely separated so that those patients suffering with COVID are kept apart from those who don't. We also have a high care respiratory ward. Some of you may know this is Neptune ward. And of course, we have an intensive care unit for COVID patients who become particularly unwell and require specialised care. I would add that there are new treatments coming along for COVID on a regular basis, But we go back to the earlier point, the best treatment is prevention, and the best prevention is for you to have your vaccine.
Fantastic. Thanks, John. And I think, yes, it was very welcome to see the Medicines Health Regulatory Authority last week approve the first antiviral for COVID, which no doubt will help many people that become infected. But as you've mentioned, the key thing is really preventing catching COVID in the first place is the best thing to do. Okay, the next question coming back to me then. So somebody would like to know, do I still need to test if I don't have any COVID symptoms or if I've been double vaccinated? And if I do need to test, then how do I get hold of kits? So yes, the basic answer is that we know that at least 1 in 3 people who have COVID may not necessarily have symptoms. So it's really important that you test yourself on a regular basis. Generally, we say the think twice rule. So try and test at least twice a week or before going to events, as we've mentioned, if you're mixing with people you don't usually mix with. This is really important even if you are doubly vaccinated. There are a lot of different ways you can access these lateral flow kits. So you can get them through your workplace if your workplace is participating in a testing-based program. There's an online home ordering system, which you can order either through the online portal or by calling NHS 119 and have them delivered to your home. And then there's a variety of places across Swindon and beyond where you can collect them, including libraries, pharmacies, and also other home collection points. So there's lots of places you can collect them. If you do go online, you can actually use a map tracker and it'll tell you where your closest collection point is. But the important thing is that you are regularly testing. And if you test positive, make sure you go on to get your PCR test and then isolate as appropriate. Felicity, coming back to you, if I need to visit someone in the hospital, am I allowed to do that?
Yeah, thanks, Steve. Yes, you are, but we have restricted visiting. So it's 1 visitor per day for 1 hour only. You don't need to be the designated person, but it should really be restricted to close family and friends. Visitors welcome in that space, but it would be really useful if you contact the ward beforehand to organise the visit. And we'll obviously have slightly different rules for patients who are sadly on end-of-life care, maternity services, or patients who are under 18. Patients who are on end of life, just to be really clear, they can have more than 1 visitor during the day, and that can be for any length of time. We've got some possibility of extended visiting, and that's for certain circumstances. For example, patients who've got learning disabilities or dementia. And we're asking that if there are any exceptions, we agree those with the nurse in charge or the ward sister. Also, just referring to the earlier point about digital, we're supporting video calls to our patients, so we'd ask that you use that option if that's possible. And clearly, don't visit anyone if you've got any symptoms of COVID or if you've been asked to self-isolate. Continue to wear a face mask and practice the good hygiene and social distancing measures that we've described earlier if you are coming in to visit a relative. Thanks, Steve.
Fantastic. Thanks, Felicity. And again, really important because we know the benefits it is in seeing your relatives when you're unwell. So it's great to hear that we're able to support that. Okay, the next question for me is on vaccine, and then I think there's a follow-up question for John on vaccine as well. So someone has asked, I've had my second COVID vaccine over 6 months ago, so am I eligible for my COVID booster jab? And if so, do I need to wait or should I contact my GP? So we know that the booster vaccine doses will be available on the NHS for those people most at risk of COVID-19 who have had their second dose of the vaccine at least 6 months ago. So these people include those aged 50 and over, those who live or work in health and social care, those frontline workers, as I've already mentioned, people aged 16 or over with a health condition that puts them at a higher risk of getting seriously ill should they contract COVID, people aged 16 and over who are the main carer for someone that is at high risk, people aged 16 and over who live with someone who is more likely to get infections, so people that are what we would call immunocompromised, and people who are pregnant or in one of an eligible group that would be able to receive the booster dose. So if you are eligible, as we've already mentioned, you will be offered your booster dose at least 6 months after your second dose. So you may be in that eligible cohort, but may not be exactly eligible just yet. So when you are eligible, you will be able to book for your vaccine appointment online to go to one of our vaccine centres or community pharmacy to get that done. You can also call NHS 119 if you don't have access to the online portal. When they are operational, you will be able to go to a walk-in vaccination site and get vaccinated without an appointment. The key thing is that you don't need to call your GP, and you shouldn't just turn up to any vaccination site without an appointment unless it is one of those walk-in sites. People who work for an NHS trust or a care home will usually get their booster dose through their employer, so do speak to your line manager about when that will happen for you. John, on the topic of vaccination then, someone has asked, if I have both my first and second dose of the COVID vaccine, why do I still need to have a third booster dose? What's the science behind it?
Yeah, that's a good question. And the answer is yes, you will need a booster dose at least 6 months after your second dose, in line with the recommendations which Steve has just listed. The COVID-19 vaccine is like any other vaccine. It generates antibodies, and which gives us the immunity, but over time that immunity drops away, and that's hence the need for a booster. So a booster dose elevates those antibody levels again and effectively extends the time you have with effective immunity beyond that of the first 2 doses. So in short, the booster does help give you longer term protection against getting seriously ill from COVID-19.
Thanks, John. And a follow-up to that one then is a resident has said that they're pregnant and she is worried about her baby's safety by having the vaccine. Can you just give any advice based on that?
Yeah, so this is a really important question, and many of you will have seen the very sad case of the young mother who died from COVID at the end of her pregnancy. The Joint Committee on Vaccination and Immunisation has advised that it is safe to have the COVID vaccine during pregnancy and whilst breastfeeding. A great many pregnant women worldwide, 90,000 so far recorded in America, have been vaccinated. This has mainly been with the Pfizer and Moderna vaccines, and there have been no safety concerns identified as yet. In the UK, the recommended vaccine for pregnancy is the Pfizer vaccine. Importantly, the vaccine does not contain live virus, and therefore it cannot reproduce and will not cause COVID-19 either in the mother or the baby, so you can be reassured on that. You also have the opportunity, obviously, to discuss these issues and any potential benefits and risks with the vaccinator at the time of your vaccine.
Fab. Thanks, John. I think that's a really important thing to remember, isn't it? Is that the vaccination programme is really important, but it isn't mandated. It is around informed choice. So if you're unsure whether the vaccine is right for you, make sure that you are reading information about the vaccine through a reputable source, such as the NHS website, but do talk to a healthcare professional if you do have concerns about whether the vaccine programme is right for you. Felicity, we answered a similar question to this earlier, but I'll just ask you this one as well. Is it safe for me to attend my appointments at the hospital?
Yeah, thanks, Steve. Completely appreciate that having an appointment at hospital can be a worrying time. Can absolutely assure our public and our patients it's a safe place to visit. So as we described earlier, we've taken some decisions on visiting, and that's an enabled precaution to keep our patients, our visitors and our staff as safe as we possibly can. Just an example of some of the things that we've got in place. We've got a one-way system as you come into the hospital at our various entrances. And a keep left system in the corridor, which has got stickers and signage, but everybody is absolutely obeying in the hospital. I can give my word on that. We're asking everybody to wear a face covering and observe social distancing. So I just ask for the public's help if you are visiting that you follow those rules as well and attend your appointment as planned.
Fantastic. Thanks, Felicity. OK, John, coming back to you then. How have your staff responded to the increase in the number of COVID patients we've seen across the last few weeks? Are they still wearing the same levels of personal protective equipment, otherwise known as PPE, as they were during earlier waves of the pandemic?
Yes, thanks, Steve. So as you can imagine, our staff are facing another extremely challenging period with not only concerns about the risks to their physical health, but also the impact on their mental health. So throughout the pandemic, we've maintained the same level of PPE for our staff, and this has been in line with national standards. So their safety and the safety of our patients has always remained our top priority. We also have an extensive health and wellbeing plan for staff that includes a wide range of support, including 24/7 helplines, mental health counselling and training of physical wellbeing activities and other interventions to support the teams. Our staff are doing their very best to see patients as quickly and as efficiently as possible, but this is obviously also a very worrying and stressful time for patients, and sometimes that is manifest by perhaps lashing out at staff verbally in the heat of the moment. So we'd like to remind all patients and visitors and any other people in the hospital that there are no circumstances in which abuse of NHS staff can be tolerated, and that appropriate action will have to be taken were this to take place. Of course, our local communities have continued to support our teams incredibly well during this difficult time, and it means a huge amount to our staff knowing you're behind us and supporting your local hospital and community services at what is a difficult time for everybody.
Fantastic. Well said, John. And yes, I'm sure all our residents understand the amount of pressure that we have seen across our health and social care systems throughout the pandemic, and will want to do everything they can to support efforts as we go forward. So just slightly off topic from COVID, but to talk about flu vaccine. So a question for me was, do I need to get my flu vaccine even though I've had my COVID vaccine? Well, yes, they're absolutely different vaccines, and although they're part of the same disease family, they are different diseases. If you are eligible for your flu vaccine this year, then it's more important than ever that you make sure that you have both your COVID and your flu vaccines. We know that with the flu vaccine, people will have lower immunity this year because obviously we've been cooped up for a real long time. So natural immunity to flu will be lower than ever. So it's really important to protect your own health and resilience as we head into winter and be vaccinated against COVID and flu. We know the flu vaccine helps you to protect others, and that's really important, particularly if you are living or working with people vulnerable, particularly in your communities. So do take the opportunity to have both if you are offered that opportunity. Felicity, the next one's for you. So it's difficult for me to get an appointment with my local GP. Why shouldn't I just come to the hospital to be treated?
Yeah, I absolutely appreciate that, and I recognise, frustration in terms of not being able to get appointments necessarily. But what I would say is I'd offer my support to my primary care colleagues first and foremost. Absolutely, we're under pressure in the hospital, but that's reflected across the health and social care community at the moment. It's really important, and I'm calling on the public's help today to make sure that we protect urgent and emergency care services for those who really, really need it. It isn't an alternative to primary care. If you go via NHS 111 online or you call 111 first, they will be able to direct you to the right place for your healthcare needs. And often that can mean that you're treated outside of the emergency department and outside of the urgent treatment centre. And that can sometimes be self-care, and also pharmacies. Pharmacies are tremendously helpful in my experience, and been able to avoid any long waits for myself and get the treatment that I needed there and then. If NHS 111, do assess you as needing care in our UTC, they can actually arrange a time, and that means you can wait at home rather than waiting in the waiting room here for a long time in the day. Our doors in the hospital, we will remain open, but really we would like to stay for anyone in need of urgent care into our emergency department. So calling on the public's health to help us with that. Thanks, Steve. Great question.
Fantastic, thanks Felicity. And then along a similar line for John, one of our residents has said that she is very aware of the increase in respiratory viruses, more commonly known as RSV, and is very worried about her child potentially picking this up at school or when they're out and about. Where should this resident seek help if they need it, particularly if the hospital is so busy?
Yes, thanks, Steve. A very important question. So for those who may not know, RSV, or respiratory syncytial virus, is a common winter virus that causes coughs and colds, and is also most common cause of bronchiolitis, which is a type of lung infection in children, particularly those under age 2 years. Last winter, we saw far fewer of these infections, in fact, amongst young children, and this was an impact of the national lockdown and COVID-19 restrictions, including mask wearing, etc. And this means that many children in our communities now have not developed the natural immunity that would normally have developed over the last winter. Australia is actually a very useful indicator to us. Their winter precedes ours, and when they have a bad flu season, we often have a bad flu season. And in this case, they've had quite a bad RSV season. And so our children's services have prepared in the expectation that we're going to see more RSV infections this year than perhaps previously. So most cases of this illness in children aren't serious and clear up in a very short period, just a week or so. And so you don't need to be overly concerned. However, you should contact your GP or call NHS 111 if your child has any of the following symptoms. So if they show laboured or rapid breathing, if your baby is taking less than half of their usual feeds or has had a dry nappy for 12 hours or more, or if your child is becoming unusually drowsy. If you're concerned and unsure what to do, please contact NHS 111 before coming to the hospital. However, you can continue to use 999 for an ambulance or attend the emergency department immediately if your child has pauses in their breathing, an irregular breathing pattern, or starts grunting, if they have severe difficulty in breathing or are too breathless to feed, or if their tongue or lips go blue. Thanks,
Fantastic.
Steve.
Thanks, John. Again, very serious messages around demonstrating that there are lots of things that can impact on our health this winter across the age ranges, particularly in those most vulnerable, particularly the very young and the very old. So anything we can do to protect ourselves and protect each other is really important as we head through the next few months. So we've now reached the end of our session today, and I hope that you found the answers that we've given you to be informative and hopefully have given you the advice that you need to protect yourself and those around you as we head into winter. A huge thank you to those people that have provided the questions that we've answered today, and also an apology if we haven't been able to get to any questions that you may have raised through the comments section, but we will absolutely take them on board for future Facebook Live sessions. So just to finish really by taking the time to say thank you for listening to Felicity, John and myself, and thank you both to Felicity and John for taking some time out to share their advice and wisdom around what's happening across Swindon at this moment in time. And finally, for me to leave you with a message around, remember, it's hands, face, space and ventilate. Make sure that you are regularly testing, and if you're eligible for your vaccine, please do strongly consider it, both for COVID and for flu. Remember, let's do this for our Great Western Hospital, because Swindon, it really is up to all of us. Thank you for your time today. Goodbye.